Is snoring keeping those in your home from a restful night's sleep? Dr. Pargett tells us about some possible treatments on today's Medical Montana. Dr. Pargett, is it possible to treat snoring?
It is, and as we all know, snoring can be a big problem in the household. Couples may not be able to spend the night in the same bedroom. People may have complaints from their business traveling partners because they snore so loudly. And at Helena ENT, I like to focus on minimally invasive treatments for people, and treatments for snoring is one of the areas that I can focus upon.
What are some of those treatments?
Well, normally when someone comes to see me, we need to evaluate their breathing passages to see where the snoring may be developing. It could be developing within the nose, or oftentimes it has to do with the palate or the back of the tongue that is there's just a little too much tissue there. And so when they go to sleep and relax and get into those deep restful levels of sleep, the tissues collapse, and that causes restriction in airflow and leads to snoring. So I have some minimally invasive techniques that I can use, a device that will create a little bit of heat in a very focused fashion in a office setting under local anesthesia that can reduce the size of the palate or the tongue or the tissues within the nose to open the passageways for breathing and reduce snoring.
What's the recovery time for something like that?
Most people are able to normally go back to work or school the next day. They do have a sore throat, and we're always able to provide some medication to help with their sore throat, and sometimes a little hard to swallow, but most people will have those symptoms pass within about a week, and usually within about 4 to 6 weeks they will have a happy member of the household because their snoring will be reduced.
I was just going to ask, you can throw away those earplugs.
That's right.
So you've had great success with this treatment option?
I have had great success and quite a lot of satisfied patients.
And it's not offered everywhere though, right?
No, many practices in the state don't focus on snoring and the treatment of these kind of breathing problems, but that's a keen interest of mine.
And at Helena ENT Clinic.
The Helena ENT Clinic, that's
right.
So
is it covered by most insurances, this type of procedure?
Sometimes it is and sometimes it's not. So we have a staff that's fully able to assess not only their medical needs, but their insurance needs as well.
Okay, and if they're interested, they can just go to your website.
HelenaENT.com.
All right, thank you, Dr. Pargett.
Thank you.